Kidney Coach YouTube channel. I'm naturopath Fiona Chin, co-founder of Kidney Coach Kidney Disease Solution, and Kaigenesis, our range of nutraceuticals designed for people diagnosed with chronic kidney disease and the conditions that go with them. And I'm joined again today by expert in the field, Jessianna Saville. Jessianna is a renal dietitian, and she is the owner director and all things great at Kidney Nutritional Institute, which is an amazing group of renal dietitians, mindset coaches, and more that work with people diagnosed with chronic kidney disease that actually have specialized training in chronic kidney disease. Jess, thanks again for joining me. I always love having you and your expertise on our YouTube channel. So thanks.
Yeah, great to be here as always. I feel like I always learn a ton from you. I come in and pick your brain a little bit. So it's nice to
vice versa. And it's funny, we've got I'm thinking about one of my patients in the mastery program that they've got. Actually, I'm thinking of two of them, one that works with you, but another one that was just seeing a normal dietitian, not renal, and the dietary advice, end stage, we've got an EGFR of 15 and they're telling them to eat a palm-sized meat portion of protein every day, and I'm just nearly fell off the chair. So I'm like, can you either please work with Jess and her team, or just send me everything across and I'm going to go through that for you, because
yeah.
So anyone listening out there, if you are going to do work with this, please make sure you're working with someone that is actually qualified to work in the field, because I am now starting to see recommendations. It might be a naturopath, a dietitian that are giving renal patients, and they are really missing the mark and potentially causing more damage by giving recommendations that are not renal kidney failure. Hence why we love K.
Yeah, that's great. Yeah, I always say you wouldn't want a heart surgeon to do an orthopedic knee surgeon operation. And it is definitely, if you need to dig in, it is great to work with an expert, because this is what we live and breathe and think about. And these are the type of patients we see. So not only like the knowledge base from what we study, but there's the knowledge base that you get only from people who are consistently engaging with patients in that condition. And you see, these are things sometimes you don't get in studies, right? What is working, what is not working, how you tweak it. And that experience, I think, is really important. So yeah,
I agree. And kidney disease is so nuanced in the way that you would prescribe a diet, that a traditional prolific diet that lots of naturopaths love to give out or whatever just will actually can potentially cause more damage. So it's going to work. So anyway, today, I digress. We're going to talk about all things diabetes and chronic kidney disease, right?
Absolutely. Yep. Excited to talk about this.
Yeah, and look, we've talked about diabetes before with the amazing Kelly Song, but Jess and I really wanted to dig into just the SGLT2s, their mechanism and mode of action, other things that we can look at, and some really great things that you've actually seen in dietary intervention, using different dietary intervention techniques, especially when it comes to balancing and regulating blood sugar levels and things like that. And so I wanted to dig in there. But first of all, diabetes, it is the leading cause of chronic kidney disease in the Western world. So just give us some stats about that. Like, if you have diabetes type 1, type 2, how likely are you to get kidney disease? So if you've been diagnosed with either type 1 or type 2, and maybe break it down for both of us, how much do we need to be worried about our kidneys?
Perfect. This is good. So yeah, and I actually have some notes over here. So about 1 out of every 3 adults with diabetes also gets kidney disease. So that's a lot of people with kidney disease, or a lot of people with diabetes. Kidney disease is part of their story also, for sure. There's, if you have type 1, it's about, the evidence has shown about 30% of patients will eventually suffer kidney failure. Now, that's different than just having kidney disease, right? About 30% of people with type 1 will eventually end up on dialysis or need a transplant. And about 10 to 40%, that's a pretty broad range in my opinion, but that's what evidence is, of those with type 2 diabetes will eventually also go to dialysis or transplant. And these stats are not meant to be scare statistics. They're meant to be aware statistics, is what I call them, because if you know diabetes is part of your story, it informs you that your kidney markers are something you should be looking at and watching, because it is, I have met so many people. It's not till their GFR is 30 or 20 that they're like, oh, and I just picked it up. I saw it at the on my records from the hospital, or on my records, that my GFR was actually down, but nobody had told me. So I went back and looked, and it's been 10 years that it's been declining, but nobody told me. That is not, unfortunately, uncommon. So as an aware statistic, if you have diabetes, your kidney markers should be done, and they are like standard labs, honestly. You should be watching your kidneys with every lab draw you get, and don't wait for your doctor or your GP or anybody to tell you like, hey, you have kidney disease. Because a lot of times they just say, oh, you have diabetes, you have kidney disease, so we'll manage the diabetes. And they don't even think about, like, you can really work together to slow progression of the kidney disease until it's so much harder.
Yeah. No, that's exactly right. And it's I mean, it's the same story with kidney disease in general. People aren't told till they're in stage 3s and 4s. And it's the same with diabetes, unfortunately, even though we know the risk has gone up. So it's really, really important that you get all of that checked and measured all the time. And I don't know about you, Jess, but I think people with diabetes, I'm telling my patients every 6 months to just have that checked. And once, or if they've got chronic kidney disease while we're managing things, it's every 3 months until we've got markers really stabilized. I don't know if you've got a different timing with that sort of stuff.
Yeah. I mean, that's great timing, honestly. That's really
good.
Cool.
All right. So walk me through some interventions that I know, and it's really exciting. You've been doing some really great studies, working with different patients and different groups and seeing some really amazing things. Walk me through some of the stuff that you've seen when it comes to diet and dietary interventions around kidney disease, and how that has had an amazing on-flow effect into the world of kidney disease.
Yeah, this is good. So let's start with where the nephrology world is at right now and where it potentially could go. So if you talk to your doctor or a regular conventional dietitian, right now the guidelines for diabetes honestly are pretty vague. Even the guidelines on how much protein you should have, it's interesting how they're written, because they say for diabetes, you should have more protein than a regular patient, but the rationale is there's 2 big guidelines, the KDOQI and KDIGO, but these 2 big guidelines, their rationales are really interesting for why they should have more protein. And I'm not against that, but their rationale is wrong. One of the guidelines, they say people with diabetes should have more protein if they have kidney disease, because otherwise they can't balance their blood sugar. That's their first rationale, which there's like a bajillion flaws in that we talk about. The other one says that people with diabetes should have more protein because they're at a much higher risk of malnutrition, which again is very, very flawed on multiple levels. The rationale for why they're recommending more protein versus someone who doesn't have diabetes, just hypertensive CKD or BKD or whatever. And so the world of nephrology, I feel like, honestly doesn't have a good strategy on how to address diabetic kidney disease. There are more and more drugs coming out to address it, but it's even like with the medications, it's tough because some medications are used at earlier stage kidney disease, because at later stage kidney disease, they're more nephrotoxic. And so you got to watch it. Like, I've had more than one patient. I was like, whoa, like, you're still on Januvia. Like, you've been on it a long time, and it's probably not appropriate for you anymore at this stage. And so go talk to your doctor about it, because they might have missed it. So it's, again, like, I just feel like it's real wishy-washy. People are like, well, maybe do plant-based, because plant-based is hot in the kidney world. Be plant-based, but have more protein, and then maybe you should include protein, because otherwise your blood sugars are going to go all over the place, because plant-based is quite heavy carb. A lot of people are like, no, you can do plant-based because it's not, and it's like a wild world. There's really not a great consensus on outcomes. But here's a couple of things. So I mean, is that what you've noticed too, Fiona? I feel like that's kind of the state of affairs with diabetes and kidney.
It really is. You know, I get like I say, patients coming across, and they can be, and diabetes is one thing where I say, we do look, especially if they're not in later stages of kidney disease, I will manage that quite differently with what I think you're about to talk about. But that being said, I think you and I are both seeing that the type of diet that works very effectively in early stages of diabetes, a plant-modified version of that, even in late-stage kidney disease, is really effective. And we'll talk about why, and it's due to the fat content and how fat is antifibrotic and how every cell of the body needs its biolipid membrane. And it's funny, I was talking to people about fats needed for hydration, which is going to improve kidney function, all that sort of stuff, which I'll let you get into. But it is amazing how it's so wishy-washy, and people have been given mixed information, not checked properly, and the inappropriate drugs. Again, how many times I see people on nephrotoxic drugs, even though they've had kidney decline flagged and not their medications reviewed, really boggles my brains.
Yeah, it is. It's a huge problem. And you'd think this would be highest priority with, 1 in 3 people with diabetes having kidney disease. But again, like you have to be your own best advocate, because these things do get missed. And for us that work in this space frequently, we see them getting missed all the time. So love when patients come in and they're proactive and they know what they need to do. Okay, so then that leads to what potentially can work, right? What can work with diabetes?
Let's dig into the drugs first, because I think we'll leave the dietary interventions for the last bit, because I find them the most fascinating. But talk to me about these new drug classes. I think they're only about 2 years old, the SGLT2s.
The hot one right now are the SGLT2 drugs, which more or less, and again, this is I was just telling you, I even learned a little bit about them tonight. But right now, more or less, what happens when you take an SGLT2 drug is that you're going to pee out sugar. And if you have diabetes, what ends up happening is your blood sugar lowers, and people will lose weight. And for some people, their blood pressure will decrease. And so my understanding of these for a long time, till like today, was like the main benefit was they reduced the glucose load in the body. And if you look at diabetes and what's going on, there's really a couple core things that you're seeing going on. One, you get these bumps in blood sugar, which causes your body to release insulin if it can, and you're going to get some inflammation and some fibrosis and some damage because of what higher blood sugar will do. So that's one really important mechanism to understand. And that ends up going throughout the whole body. And so if you start having inflammation in one area, because again, diabetes is also linked with heart disease, and diabetes is also linked with like probably every organ that's out there.
Yeah, well, we know Alzheimer's, type 3 diabetes of the brain.
Alzheimer's, et cetera, right? It's this glucose load, or this mismanagement of glucose and the mismatch of insulin and the glucose. When you start seeing those things happen, you're going to have decline across the board. And some people just whether it's because of their weight or how they're genetically connected or what they're eating, can be a really big problem. So on the SGLT2s, they're interesting because they do cause you to pee out sugar. The big benefits you're seeing, what you'll see touted a lot, is the weight loss, the reduction in blood sugars, and the decrease in the blood pressure. You can't use them at later stages. They don't have good evidence for that right now, though there are some pending studies. So stage 4 and 5, they're not used quite as readily, but in every other stage, it's like, man, got kidney disease, SGLT2, even if you don't have diabetes, but definitely with diabetes. But there are some other renal protective effects, which is what I was learning about tonight, that they also help. More or less what they do is you got these little, what do you call them? The glomeruli, like this piece of the kidney. It constricts it. And when you constrict the glomeruli, which is what the SGLT2 does, then you're going to reduce the pressure in there. And that intraglomerular pressure, the pressure within this glomeruli, is one of the things that causes eventually the demise of the glomeruli and some of the kidney disease problems. So if you can reduce the pressure there, which is what SGLT2s do, then you're going to have a reduction in kidney decline. And, they say that they can improve tubular oxygenation and metabolism, reduce renal inflammation and fibrosis. So when I look at this drug, it does have side effects, but sometimes I'm wondering, okay, there's a lot of people that don't want to take a drug. If this is what an SGLT2 does, and it does have some interesting evidence right now on how it can be helpful, but if you look at this, I always say, what could we do on those same pathways with nutrition, lifestyle, and herbs, right? If we can use something more natural, we're going to get a lot of benefits without the side effects. And that's usually where my mind goes.
Yeah.
On a holistic approach.
Yeah. And we were digging in before that berberine, from my understanding, is it also works with renal tubule dilation, so making the tubules wider. I know it acts on that via the mTOR pathway, so I don't know if that's exactly the same. It's why we use berberine in things like polycystic kidney disease. It's why we know that people with polycystic kidney disease and type 1 or type 2 diabetes, the cysts grow twice as fast, and they're always a lot larger within the kidneys. So we know that dysregulation in blood sugar, and that's why certain diets, which we'll dig into in a minute, work very well in PKD, but berberine particularly works via that same pathway that we're trying to stimulate in, say, a ketogenic type diet, and it works via the dilation of the tubules. With what happens is when you get tubule constriction, as you were talking about, you get continued you get this dilation, you get this continual assault or damage to the tissue in there, it's fibrotic. Whereas berberine resets that ability to constrict and vasodilate, basically, and so that stops the tissue damage happening. If it's exactly the same pathway, I'm not sure. Like I say, it's an mTOR pathway. I'm not sure if it works the same. And we've got some other great herbs like banana leaf, gymnema, cinnamon, but again, I don't know exactly how they work inside the glomeruli of the kidney because I've not dug that deep. Most of these herbs have a general anti-inflammatory effect and, of course, work at balancing blood sugar levels. So I'd have to dig into that one.
I know. Now we're curious, right? That's what I'm saying. I was like, here's how SGLT2 looks. And then I was looking at the research on each of those pieces and seeing, like, what are the other possibilities? What else is out there? That's fun to do. So. And
I just wanted to circle back around. So give me, just so, because I know people will be curious, what are some of the side effects of the SGLT2s? Because I know what happens is people go in and their doctor's like, SGLT2, new medication, it looks like it's protecting
forever. Yeah, I'm pretty sure that they have, I'm actually going to Google it so I can give you a full list. Because I'm thinking about the liver, but I always get this mixed up with some of the PKD drugs that we work with. So some of the big side effects, this would be good. So some of the side effects would be like a UTI, which honestly makes sense because if you're increasing sugar into your urinary tract, and you have fungus or you have candida or you have other, because your urinary tract has its own microbiome, right? We always hear about the gut microbiome, but your urinary tract has its own microbiome too. Less talked about, in my opinion, equally, if not more significant when it comes to kidney disease. But if you're going to push a lot of sugar through there, you are going to feed certain microbes that love sugar. So
totally makes sense.
It's a potential side effect that you'd be aware of and be watching for. If you have diabetes, of course, if you're lowering your blood sugar quite a bit, you'd be at risk for diabetic ketoacidosis. So that would be one that you should have a smart doctor who's looking at your overall regimen and has some good follow-up and knows you're testing your blood sugar when you start these. But that is some of the side effects that they saw in the research as well. There is an initial drop in kidney function when you take them. There's a couple drugs that do this. Losartan does this for blood pressure. The SGLT2s do this, which is why they won't use them at later stage. Because if your GFR is 10, 12, 15, and you drop someone's GFR by 5 points, that's a lot, right?
Yeah.
Whereas if your GFR is 40 and drop by 5 points, that's still a lot, but it's not unrecoverable.
And it makes sense too, right? Because the kidneys are going to be suddenly working harder to flush all this sugar out until that sugar's sort of reset in the system and the other benefits sort of kick in. So that makes complete sense to me.
I mean, it totally does. And again, you're thinking like you're playing the kidneys as they decline are resetting into new homeostasis all the time. So if you start a drug that now is constricting the intracellular and then like everything's changing, you could definitely see a decline from that. And then I think right now there's a lot of hesitation on if that decline is actually gives enough benefit to the patient.
Yeah.
You know, because even like the weight loss that comes from it, the change in blood pressure, that's still not an overnight thing. That's 3, 6, 9 months down the road. So if you're kind of on the edge of needing to look at transplant or dialysis, your physician's probably not going to recommend an SGLT2 because the benefits may not be soon enough or fast enough for you to actually get an outcome.
Yeah. And I guess, you know, one of the things of chronic kidney disease is the kidney's loss of ability to maintain homeostasis. So you put a drug in there and it doesn't bounce back to that homeostatic balance that it should have, and it's just taking too long. So that all makes sense.
Makes sense. And I guess that's why I really love using, well, I mean, I don't use the drugs because I'm not a doctor, but that's, I feel like one of the big benefits of an herbal regimen over a pharmaceutical regimen. I mean, there's lots of benefits, but that's a big one for late stage because herbs tend to be a lot more gentle, but equally efficacious. And so sometimes, and you can titrate them a lot slower and bring them in slower and at different stages. Like, I just feel like you can customize it more. So I think that's one reason I would definitely prefer that for a lot of patients. A couple other risks that they saw in the studies, hypotension. And again, if you're on a lot of blood pressure meds and you change the whole mixture of what's going on, you could have a drop in your blood pressure, hypotension being low blood pressure, and increase of bone fractures is the other one.
So it's pulling calcium out of the bones? Is that part of what it's doing there?
Yeah,
so it's
I mean, it is on I've got a couple studies up, and they do have I'm seeing what the pathway is on it. But I don't know what the pathway is exactly on that, but it has been cited in every single one of the SGLT2 inhibitor problems. And again, when you look at this, and I mean, this is uncommon, right? But they probably saw this. So it's hard to say, was it the drug that caused it? Was it like that particular study population? And I don't know, but it is one that they had to cite in their package insert and in their research. So bone fractures would be another one that potentially could be a problem. So.
Okay. All right. Yeah. I've got a couple of mechanisms of how that could be in my head, but I'm not definitively sure, so I won't comment until I have a look.
There you go.
So let's move off that onto this dietary intervention that I know you've been looking at studies with. We know Santa Barbara's been doing some nutrition, have been doing some studies around this stuff as well. Yeah. So let's talk about that, because I think, especially in early stages of diabetes, and I know when I spoke to Ian Lake, Dr. Ian Lake, he's a specialist in this area, and he was saying that, and we're going to talk about the ketogenic diets we're about to talk about, but he was talking about, and it was one case, so I'm talking about one case here, where the parents were very proactive. They put a 6-year-old that was diagnosed with type 1 diabetes, got the child in what we call the honeymoon phase, which means that the pancreas and the beta cells are not completely destroyed. They can still produce insulin. So you get this honeymoon phase before the beta cells become exhausted. They no longer can produce insulin. That's when people have to start injecting it. They put the child on a very strict ketogenic diet early, and he stayed in honeymoon phase. The child is now 9, so it's been 3 years.
Wow.
And it's never developed into type 1 diabetes. Now, again, that's one case
Yeah.
where they have very early intervention, but studies yet aren't really looking at putting children, which is what we need to do, on ketogenic diets. Because I think people think in their heads that's a hard and mean thing to do, but I go, versus a lifetime of injecting insulin, I know what I'd be doing as a parent. So walk me through the ketogenic diet and what you've seen it do with kidney disease and with diabetes.
Yeah, so I've had quite a journey with this as a professional, because again, my training is quite conventional. And when I started practicing very focused in the CKD space about 8-10 years ago, we were just really common, like carb counting, count your carbs, make sure we have protein or fat with your meals, so you kind of level out the curve on your blood sugar. Like, that is the conventional advice. And over the last couple of years, because we've been more engaged in the ketogenic community because of our work with PKD, I've really seen some interesting things that are happening in that area. Now, I think absolutely there's a couple of things to acknowledge here. People that are coming from a regular, like ordinary American diet, and they shift towards a more plant-focused diet with diabetes, they do see a pretty solid improvement in their blood sugars, because you start getting a lot more fiber. And that is really a huge key with diabetes. It doesn't matter where, there's controversy within the keto world, but otherwise, for the most part, if you look at a lot of the experts that are in this space of managing blood sugar, fiber is key, right? Fiber is really, really key. So you can get kind of this initial benefit, and for some people it's enough that that's all they do. They focus more plant focused, and they really get a bump in their kidney function, better A1C, their diabetes more managed, and they're super happy, and that's great, right? However, there are other people who maybe they switch more plant-based and they have diabetes, and now they feel like they're on kind of this blood sugar roller coaster, or they feel like unsatisfied all the time, or they're just not feeling good, or they're just not getting an outcome, period. We've also seen that with a ketogenic diet, and I'm going to tell you a couple of things that shifted my brain on this, because I was not in the space of using ketosis outside of PKD for a long, long time. But for people that are really, really insulin resistant and they just cannot manage their blood sugars very well, a ketogenic diet can be such a godsend to them. It works so well. And it's interesting because if you start looking at some of those, whether it's practitioners or companies that are using ketogenic diets, they are reporting some pretty interesting and positive outcomes on the kidney space, or secondary outcomes. And I'll give a couple examples of this in the ketogenic space. And these are ketogenic diets that are not modified for protein. So they actually probably are a little bit higher in protein, and yet they're having pretty positive results in the kidney space, which is really interesting to me. So one company you can look at, it's pretty big. They've got a pretty good amount of research. They got a big old grant right now that they're looking at. This is Virta Health. And they use ketogenic low-carb diets. And they're getting phenomenal results just with diabetes and some good secondary outcomes with kidney disease. The place where this really changed my mind, or the conversation, was one that I had with Dr. David Unwin. And he has, we were at a ketogenic work group together, and I got to pick his brain a whole bunch. And I know I've shared a little bit about him. I really admire him as a professional. But he was telling me that when he started using ketogenic diets with his patients, I can't remember, 10 years ago or so, I can't remember how long ago, in his clinic, and he was starting to report these results, he would go to conferences, report on his results, talk a little bit about it. And he said the dietitians would stand up and lambaste it. And they'd be like, how can you do that? You're going to knock out everyone's kidneys. You can't be using ketogenic diets with them. And, like kind of just really not super nice about it. And he's like, well, I got all the data, so I'm going to just go back and run the data. Maybe I'm wrong, I don't know. So he has all the data, and he went back and ran it. And lo and behold, you look at his study, real world, right? So it's not a clinical trial, but it's just like, here's what I did in my clinic, and here's what happened. He actually had, again, on a non-protein controlled diet, some pretty positive results on the kidney function. And these were for higher, CKD3 or above, which is important to note.
Yeah.
But he was seeing some positive kidney outcomes by using a ketogenic approach. And I really pondered on that quite a bit after talking with him and just thinking like, well, what are we wrong about? What are we pushing and encouraging people to do that maybe we need to step back from or need to implement more? And I know for us, as we've used ketogenic approaches with our patients with diabetes, that we have seen some pretty solid results at this point where the GFR does go up. They get off their insulin. They, they see some improvement in their kidney function. And so I think it's a really important option for patients to have. I'm not saying it's the only option, but ketogenic diets, and people live ketogenic lifestyles for years and years and years and years. It's actually more sustainable than you think. People that really want to dig into a ketogenic lifestyle, you can do it at late stage. You can do it at a GFR of 10. You can do it at a GFR of 15, or you can do it at a higher GFR. And it's safe and effective, and you're able to do it even if you need to initially modify your protein intake and then slowly add it back in. But that fat, right, high fiber, high fat is really, really effective for managing blood sugars and getting some of those benefits that naturally occur, the anti-inflammatory part of ketosis with the beta-hydroxybutyrate. Really, really there can be some solid benefits. Again, I'm not saying it's for everyone, and I'm definitely not saying throw all the protein recommendations out the window, because if you're stage 4 or 5, I do think it's still important to be cautious. But it is a possibility, and especially if you're not getting results otherwise, I 100% would encourage it, and really, really, really encourage it, because it can be an actually super delicious diet.
Yeah, well, I mean, I'm ketogenic 100% of the time. My body's so ketogenic, keto adaptive, that even if I get a couple of extra carbs in there, it still seems to burn keto bodies. But it's interesting. I was doing some digging into adequate hydration and how hydration properly works inside the cells. And part of this really dropped in for me of why ketogenic diets are so effective. And as you would know, but people out there might know, that all the cells in the body are made up of what we call a bilipid membrane, which means that you've got this double membrane that's made of fat. And in between it, it's fat. And in those are phospholipids, and those phospholipids, fat is needed for transporting nutrients inside the cells and removing waste outside. It goes through a fat membrane. Now, if you don't eat enough good quality, and I'm talking good quality fat, I'm not talking hydrogenated fats, deep fried stuff, seed oils, all the things that become what we call cancer-causing hydrogenated. I'm talking about good quality pasture-fed meat, eggs, avocados, olives, olive oil, those kind of things. That if you have a diet full of those, you're feeding this biophospholipid membrane, so your cells are puffier and healthier. And if we think about what happens in the end stages of chronic kidney disease, we get fibrosis, which means this beautiful soft, pliable tissue that we should have becomes hard and fibrotic. And a lot of that is due to the degradation and the loss of fat in the fatty lipid membranes. That's what causes the harm, right? And we're putting in bad fats that are hydrogenated or oxidized and causing oxidative damage, inflammation, which we know is a oxidative damage and inflammation, and then into fibrosis is the hallmark of kidney decline. So one is this keeps this phospholipid membranes healthier and happier when you have a high-fat diet. It means that the kidney cells and cells right throughout the body can actually get rid of waste more effectively and bring oxygen and nutrients inside. So that has all the benefits that we know of. The other thing that's interesting is hydration. A lot of people think hydration is water in, and the clearer your pee, the more hydrated you are. Just learned that that is just not true. As we know, 70% water, but not, I think it's about 80 to 90% of that water is inside the cells or the lymphatic tissue. That's where water should be. Hydration is actually about the effectiveness of getting water inside the cells. That is proper hydration. And as we age, we lose, because the phospholipid membranes are becoming harder due to oxidative damage, inflammation, eating a poor diet. Because we're losing this lovely fatty membrane, we're not able to transport, because it's an electron pool, because you're pulling water across fat. And we know that water is hydrophilic, so it moves away from fat. So you need this electron pool to draw water inside the cells, and that requires this very healthy lipid membrane and mitochondria to work very effectively, because they charge up the health of this pool. So if I read a study that said that if you were able to hydrate at the same rate as you could as a baby all through life, you'd stop aging. Part of aging process is this inability to hydrate, meaning, and their definition of hydration was pulling water inside the cells. Then you think about what kidneys do and water, and I go, fascinating, and in diabetes, what of course happens is we end up being extra thirsty and peeing out a lot of water. And I suspect it's due to what happens in diabetes, and with so much blood sugar floating around the system, is part of that is it's losing the ability to draw water inside the cells. So I was thinking about this as well, and I'm like, wow, it completely makes sense to me that a ketogenic diet, apart from everything else that you said with, your pancreas is we're moving into ketone bodies and BHP and all those sort of things, but also I suspect we're improving the health of the bilipid membranes. Fat also feels ATP differently, so we're not working on this blood sugar stuff. So the ATP suddenly, once it becomes ketogenic adaptive, works more effectively. Therefore, we have the magnetic ion ability to draw water across a much healthier cell. So we're hydrating cells far more effectively, which is going to help kidney function improve. And then, of course, we're getting rid of this fibrotic process that happens deep inside the kidneys, which is the hallmark of end-stage kidney disease, when we lose this lovely ability of the nephrons to be flexible, basically, that become hard, and then any protein just punches holes in there, that we're improving that. So I think that's another mechanism as well. So again, healthy fats, I mean, they just got so brutally attacked in the 80s and 90s, didn't they? When we went low fat, and high, and then if sugar went in everything. And of course, our rates of diabetes and everything went up. So I'm like, for me, through so many mechanisms, a ketogenic type diet, and in later stages, plant-based ketogenic diet makes sense. And again, you can do that and still modify protein and have lots of healthy plants in there, and not blow protein intake out the window if you don't need to. I think, again, because people hear ketogenic, and I don't know why people put that with protein, but it's not. It's a high fat diet. So
that's exactly right. Yeah. I mean, I think you think, like carbs, a ketogenic diet means carbs are out. So if carbs are out, it means protein's in, but it's just a high fat diet. And that is a fascinating, I really like your thought process around that. And I think what we're going to see, honestly, over the next decade in the research that is coming into the kidney world, because again, really, there haven't been super significant advances in maybe the last 50 years for kidney disease. So that's why everyone's super excited about SGLT2s. And there's a bajillion drugs that are coming out with autoimmune kidney disease, which honestly all they're doing is measuring proteinuria, but that's another conversation, right? But what I think that we're going to see more and more how important it is for us to be cognizant of that glucose load and the sugars and the carbohydrates in our diet, not to put one more thing, right? Sometimes we're like, one more thing, I can't eat all this protein, and then I can't eat this, I can't this. And now you're saying don't eat more sugar, but it's really about thinking about where your low-hanging fruit is. So you don't have to do everything, right? Because dietitians are don't do everything. But what is the most important thing? And for some people, modifying the carbohydrates is the most important thing. And again, like it's truly not as hard as you think it would be. Sometimes people say, if I modify carbs, pizza's out forever. How can that be like best food in the world? I cannot imagine a life without pizza. But that's a little bit of a big jump because it's not about eliminating everything forever. It's about knowing how you use what is good, how you use enough fat, how you really learn that lifestyle. And a lot of times, if you're willing to experiment and walk that road, you'll find that some of the things that you thought you were going to really miss, you either work them in or you find out you actually don't care about them as much as you thought you did.
Well, yeah, that's exactly right. And I will say, since being ketogenic and things like that, like having MS, the biggest side effect of MS is crippling fatigue. And I'm talking, if you haven't experienced MS fatigue, there are no words for it. It is, you can't string a sentence together. You can't even think about getting up and where the cups are. To string a thought process together of I have to get up and go and where are the cups I have to find. Like, the fatigue is debilitating. It's next level. And that is the biggest issue we have with people with multiple sclerosis. And I've never had any MS fatigue. And I have no doubt it is because I've been for a very long time now, 10 years, on a ketogenic diet. My body is so ketogenic adaptive, and I get a huge percentage, 60% of my calories come in through fat. And I get through eating really good quality dark chocolate and macadamias and avocados. And I'm an olive freak. I love olives and olive oil. And I'm right into the fatty 15, the C15 pathway, which is in ghee. And I actually take fatty 15 supplements. And there's no doubt that when you change that pathway, people's energy levels improve, their ability to concentrate improve, and you firing up your ATP in a different way, especially in kidney disease. We know that mitochondrial dysfunction is part of a lot of these chronic diseases. And so you prevent that mitochondrial change, which I think accelerates all our diseases like heart disease, kidney disease, a lot of our autoimmune diseases. So that's, like I said, I've been 10 years ketogenic. So for me, it's very effective. And my kidney function is, because of course it's something I keep an eye on, is perfect. And so it's that high fat diet over 10 years has not had any detrimental effect on my kidneys at all. So, and I have a family history of kidney disease, which is of course why I've got such an interest in this. So
interesting. You're a walking case study of success for sure. And again,
in the MS world for sure. So but I agree with you. I think, and I don't know about you, but I think as practitioners, part of us, we get gun shy when it comes to doing these big radical diets and things like kidney disease, because we think, what if we cause more damage? Because we're thinking too, well, we are taking ketogenic diets, we're taking that out, but there's this fat diet. But I really do think that we're giving the body a different way to process energy, and we are improving the cell lipid membrane by putting in good quality fats. And that on-flow effect, because your brain and your whole central nervous system's fat, your skin's all fat, we forget how important good fats are. And when you can get those inside the cells and you're hydrating better, you'll have more energy, more clarity, better clear mental thought, all the things that we know people with kidney disease, they're the big side effects, right? Fatigue, foggy brain, itchy skin. And so if you've got fat in there, your skin gets nicer. All those peripheral symptoms are the first things that I see disappear with ketogenic diets. And then we start working at this really deep cellular level where these damaged fibrotic kidney cells suddenly have the tools to puff themselves up a bit and heal. And I think you need fat as part of that pathway. So
I think so too. And again, I always compare it to, a house and using all your tools, right? If all you have is a hammer to build your house, within all the different things, right? Herbs, different types of diet interventions. Again, there's a lot of different ways you can approach diet, and ketogenic is a great way to approach it. It's not the only way, but it is a great way to approach it. Diet, all these different things. If all you're doing is building a house with a hammer, that's okay, but it can get a little bit rough if you have to saw a board. And so with your hammer, right? You need all your tools, and sometimes you start with one tool, right? Maybe you start with your hammer, which is increasing more plants in your diet, okay? And build as much as you can. And then you're like, whoa, like, hey, I got some results, not quite where I want to. Now let me add something else into my toolkit. And you're like, okay, I'm going to add a saw. And you're like, wow, this is amazing. Like now I can like get the boards to be just right. And you're like, oh, I'm totally going to use this. And now you're starting to get even better results. And then you add on, another thing. You're like, I'm going to look at decreasing my sodium intake. That's another tool to help with kidney disease, and now you've got a level. So now your boards are more, it's like every intervention that you do, you don't have to do them all at once, but having all the options is going to always help you get the best outcome over time. And I just think ketogenic diet should always be an option. And if you work with a clinician who's familiar with them, and there's not, honestly, in the nephrology space, not a lot. It's not actually a therapy that dietitians are trained on in their schooling. You kind of review it a little bit with epilepsy, just so you know it's there. You don't get trained on it necessarily.
Yeah, right.
I had to learn it, and I've been a dietitian for a long time, right? Almost 20 years. But I had to learn it a few years ago. Like, how do I do a ketogenic diet? What does it look like? What are things I'm thinking? Like, I had to learn how to do that. So, find a professional who's familiar with them. If you're like, I'm going to use this tool in my life, and there's a lot of reasons you use it, find a professional that's familiar with them so they can guide you and be smart about how you do it, and you can get great outcomes. And I will say, just as a medical representative, type 1 diabetes, I really think it's actually really critical that you work with a smart medical professional when you do it. Don't do ketogenic diet just off the cuff. You can really have some big problems. I really think it needs to be managed with a professional for type 1. And type 2, if you're going to use ketogenic diet, you must actively be testing your blood sugar, very involved with the impact that your medications have on your blood sugar, because they're going to change, and you do not want to get hypoglycemic. So if you're uncomfortable with some of those things or not knowledgeable, those would be other reasons that you want to work with a professional before diving into a ketogenic approach.
No, I'm glad you said that. And you're right, especially type 1, because you'll find, and I know, again, speaking to Dr. Ian Lake, and you probably found this with the doctor, was it David Unwin that you spoke to, is people can come or take their insulin. Like Ian Lake went from, I think, I'm going to get the initial units wrong, but let's say it was 20 to 40 units of insulin he was using, big doses. And he's come to like 2 units, I think.
Yeah, he's like, I use the smallest amount possible. I got half of them. But it's like the smallest amount possible, and he's done it. I can't remember how long, 8 years or so, but a long time.
And he does, he runs marathons and doesn't eat for 4 or 5 days, and they're like, you can't do that and he's type 1 diabetic, and he does. He's like, well, I proved you wrong. So, and he managed to get his down. And being type 1, he doesn't produce any insulin, so of course he's still got to take insulin. We're not talking about curing type 1 diabetes. Once your beta cells are exhausted, they're exhausted, which is why maybe possibly working with a professional doing this in the honeymoon phase might be something to look at. But from 20 units, and it may have even been higher, down to 2, which is the most minimal possible, which is just ticking along, is amazing. And for those with type 1 diabetes, and unfortunately I've had 2 friends, they weren't patients, die from type 1 diabetes, where in their 20s and 30s, they just got, lazy is a wrong word, but people get over injecting insulin all the time, and it's a rebellion thing. And unfortunately, the amount of damage that can cause long term, and the flow-on effect to damaging kidneys and eyesight. And they died from kidney disease from mismanaged type 1 diabetes in their 20s. And that's, imagine if you were able to reduce your insulin load and not have that feeling like you're sticking pins in yourself all the time through a ketogenic diet. Might be a great way, especially for teens and adults, of not feeling like they're hooked up to having an insulin pump or having to do this all the time. But to your point, 100%, they're that effective. You absolutely need to be working with someone and monitoring that, because they can have very quick, rapid changes. We don't want anyone ending up in ketogenic comas and all of those sort of things. So,
Yep, 100%.
So what else have we got to say about diabetes, Jess? We've covered some big topics there, from the SGLT2s and the new medications coming out to some potential herbal mechanisms to ketogenic diets. Anything else around the field of diabetes and kidney disease that you want to pass on?
I mean, there's 7 billion things we could dig into, but I think on this one, a couple key takeaways would be that if you have diabetes and kidney disease, that give a ketogenic diet a try, at least for 90 days, and see where it takes you and your numbers, because the proof is going to be in the pudding. It's going to be in how you feel. It's going to be in the deprescription of medications. It'll be in the decrease in your blood pressure, and it will be in your, the palatability and how you like the nutritional approach. And I mean, I'll say this over and over again. I think every human ever should try a ketogenic diet. So you know what it feels like, because it can feel big and overwhelming, or it can feel like it's linked to the skinny lady on the magazine. But it's just a really good basic human skill, honestly, to learn, in my opinion. But I would say the takeaway is give it a try if you're really wanting to dig into your blood sugar management and improvement of your kidney disease. It's kind of two birds with one stone. If you feel like you're not ready to take on that big of a step, then you can start a couple steps lower, and a dietitian can help you figure out what those would be. Maybe it is in just increasing more fiber in your diet. Maybe it's increasing the fat in your diet, but you're not in full ketosis yet. Maybe it's getting on some of the right herbs or supplements that also impact blood sugar pathways, like berberine you mentioned. But sometimes you can start a step lower, start getting some momentum and results, and then you could try a ketogenic diet and see how much further it can take you. But, use it as a tool. Use it as a tool. And I will say, don't expect that your physician is going to mention it as an option, because they won't, but it is an option for sure.
Yeah. And I would say to that, don't also expect your physician to be on board. I've actually had a lot of pushback from patients where I've like, let's do ketogenic diet, and they've gone into there, and I'll be monitoring them. So they're well monitored, and the physician will be like, holy cow, no, we only use those in diabetes, because they don't understand fat. They don't understand. People hear fat and they think you're going out eating McDonald's and whipped cream. And it's like, no. All we've done is we've increased avocados, and we've gone for very good plant sources, and we've maybe got some pasture fed meat in there if you're in the really high stages and things like that. And it's fascinating to see how an untrained physician will have such a pushback about a ketogenic diet, simply because they're completely uneducated and actually have no idea. And so as a patient, you need to be self-empowered enough to understand the basics of it, because when you question them, you'll realize they have no idea what they're talking about when it comes to fat. Definitely my neurologist didn't when I said I'm doing ketogenic diet, and he's like, well, you're going to get deficient in this and that. And I'm like, but that's all in ketogenic diet.
It is true. You do have to advocate for yourself for that if you want to move into that approach. And again, like I love to use the negotiation tool of time, right? I'm going to give it for my own personal negotiation with myself. And if I'm working with a professional who I respect them, I want their support, I'll say, hey, I want to try this for 90 days. I am seeing some benefits. I know you might be nervous about it, but in 90 days, like we can see either way how it's going to work for me.
Exactly. So, no, I agree. So, Jess, if anyone wants to get a hold or work with you, they're going to head to kidneynutritionalinstitute.org. There you'll see a about us, and you can go down to the team and have a look there. They've got some amazing free resources on there as well. And now, correct me if I'm wrong, are you doing something with diabetes in the new year?
Oh, yeah, of course you should mention that.
Do you want to mention what's going on?
So we have our ketogenic program. We ran with over 200 people with polycystic kidney disease. And we are doing a beta test of it in the new year. The date has not been finalized because we're waiting for a couple of our partners that use CGMs. But it will be sometime between February, March, and April. But in the new year 2024, we do have a wait list on our website. So if you go to our website and you click on diabetes and kidney disease, you can get on that wait list to join that program. We based a lot of it on our other ketogenic approach, and people have an incredible experience. It is a combination of mindset and nutrition that we work at, because we really believe that a lifestyle is something that you need to embrace from like the inside out instead of just like what you put out into inside. But we really value the inside out approach. And so we do that during this program, and you just walk through it feeling like a champion, and you have cheerleaders in ketosis within a week or two, some people to help you manage all the pieces of it, recipes and meal plans, and yeah, the energy of the group as a whole is really, really powerful. So good combo of like personalized approach within a group setting where you still meet with your dietitian one-on-one. Great programs. If you have diabetes, kidney disease, go get on that wait list, because we will release information on that beta test coming up pretty soon. And our beta tests are always like way discounted to start. So it'd be awesome to come in on that first group.
Amazing. And do you have to be in the US to participate in this, or can you be anywhere in the world?
We have everybody sign up, and we kind of see where the chips fall. We do have priority on US participants, because we have more dietitians that are licensed and able to practice in that area. But if you are overseas and want to work on this approach, definitely still get on the wait list, because if we have a lot in one area, we try and find a good dietitian that it can work with us. And then we put a group together in that area.
Amazing. So for anyone that missed it, it's kidneynutritionalinstitute.org. And then up the top there, is there a bit that says diabetes and kidney disease?
Yeah, if you just click on for patients, there's a drop down, and there's a work with us where you can schedule a free call and talk with us a little bit more on details for you. Otherwise, all the disease states are listed: autoimmune, polycystic kidney disease, diabetic kidney disease, and you'll click on that and you're able to go onto that page about diabetes and kidney disease.
Amazing. Well, Jess, thank you for your time, your wisdom, and I'm really excited to see how this goes in the early next year. So we'll have to stay tuned, and definitely once you've done that, we'll have to get you on and we'll go back through talking about the results that you got from the beta test and
that'd be
how
awesome.
that goes. It'd be really exciting.
Cool.
All right, remember to hit subscribe and like. That means that you'll get notified anytime we put out a new video. If you want to know more about us, head to www.kidneycoach.com. You'll find all our products and links to our Facebook page, Instagram, and everything else that we do on social media. But you'll find us all on Facebook/kidney disease, same with Instagram. Jess, thanks again. Always value you. And to everyone listening, thanks for being part of our community. We hope you found this useful. Till next time. Bye.
Bye-bye.